Hello, we are students from the Los Angeles Southwest College Nursing Program, and we are here today to inform you about SIDS, Sudden Infant Death Syndrome. Hola, somos estudiantes de enfermería de la Escuela Los Angeles Southwest College, y hoy le vamos a hablar del síndrome de muerte súbita infantil. What is SIDS? Sudden Infant Death Syndrome is the unexplained death of an infant younger than 1 year. SIDS is sometimes also known as crib death because the infants often die in their sleep in their cribs. The cause of SIDS remains unknown, but some medical researchers have a theory that it could be related to a brainstem abnormality and the regulation of cardiorespiratory control. SIDS is the third leading cause of infant deaths from birth to 12 months of age. According to the American Academy of Pediatrics, the peak age of SIDS occurs from 2 to 3 months old, and there are higher rates in males than in females. African Americans, American Indian, and Alaskan Native infants are among the highest rates of SIDS. There are lower incidents of children who use a pacifier to go to sleep, as well as infants who are breastfed for up to 6 months.
Signs and symptoms. The infant is not breathing, is blue, and lifeless. Frothy blood-tinged fluid is in the nose and mouth. Infant may be found in any position, but typically is found in a disheveled bed, with blankets over the head and huddled in a corner. Infants may appear to have been clutching bedding. Diaper may be wet and full of stool. Next, I'll be talking about diagnoses. According to the CDC, while most illnesses or disease are typically diagnosed with similar symptoms, SIDS is a diagnosis that can only be made after all other potential causes of sudden, unexplained death have been removed through diligent case analysis, which involves a detailed inspection of the death scene, a full autopsy, and a review of the child's medical history.
When discussing sudden infant death syndrome, we have to include both physical risk factors as well as sleeping habits of the infant. For sleeping habits, co-sleeping and sharing beds, non-standard beds such as couches, sofas, day beds, and the parents' beds, the use of soft pillows in the infant's crib, the use of toys and stuffed animals in the infant's crib, prone sleeping, which is sleeping on the stomach, that can cause airway obstructions, affect the temperature balance, and the arousal state. Soft bedding, such as water beds, sheepskins, bean bags, pillows, and quilts, and head coverings by blankets. For physical risk factors, smoking while pregnant and secondhand smoke, brain defects, because in babies born with brain defects, the portion of the brain that controls breathing and arousal state might be affected by that. Low birth weight and premature birth. Respiratory infections. Prolonged QT interval, which has to do with the heart rhythm. Age. Babies under the age of 11 weeks are at the highest risk. Sex. For reasons we do not understand, boys are more likely to die of SIDS. And finally, family history, such as a sibling or a cousin who died of SIDS.
Even though we cannot guarantee the prevention of SIDS, there are ways parents can help their baby sleep safely. Avoiding exposure to tobacco smoke, placing the baby on his or her back while sleeping, keeping the crib free of pillows, stuffed animals, and thick quilts, using a firm, tightly fitted crib mattress, preventing overheating, keeping the baby's head uncovered while sleeping, breastfeeding if possible, offering a pacifier during naps and at night, avoiding co-sleeping but keeping the baby in the same room as the parents, and maintaining immunizations up to date.